There are probably, and I can fit, off the top of my head, I could probably name 5 or 6. Traditional, what's called diversified adjustments, where you might hear that popping sound that you had mentioned earlier, and also other methods called an activator adjustment, where there's no popping sound. Things such as drop table adjustments, flexion distraction, Gonstead. There are many different types of ways to adjust. Some that use only X-rays to do adjustments, some that don't need X-rays at all. So there is certainly. And in my practice, as an example, I have about 4 or 5 different ways to do an adjustment to make care most specific or for each patient coming in.
Okay, so Zan, I'm going to come in. How long is a typical session, and then how long does the therapy last?
Okay. Well, if you're getting chair massage, it can last from 5 minutes to 20 minutes typically, if you want a chair massage like in a corporate setting. If you came in to get table massage, it could be a half hour to 2 hours for your session. And the last question was?
How long would therapy last? How long would I be going to you?
Oh, it's up to you. A lot of people come once a month. Some people come every other week when they have an acute injury. Some people come twice a year, So it's up to the individual, and I don't tell anyone how often to come. I will make suggestions, but it's all up to the individual. Typically, every 4 to 5 weeks, people come.
Louise, it's I'm going to kind of continue that same question, I guess. How many times do people come to an acupuncturist? Is it an ongoing thing? And how long would it last once you're in the office?
Okay, well, the first visit at Reservoir Family Wellness would typically take about 75 to 90 minutes. And that includes a very comprehensive health intake and medical history questionnaire. We go through all the body systems and not just dealing with whatever the issue is that a patient is coming in for. And that also includes a treatment. And the typical time period for being treated with the needles, you rest and relax for approximately 20 to 30 minutes. How long will it take before somebody feels an effect from the acupuncture? That depends on the person, what they're coming in for, the constitution or overall health of the person, how long they've had a particular issue. It's a lot easier to treat an acute syndrome than it is to treat something that's been going on for a couple of years or something. So a lot of that depends on the person. But I typically try to tell people they should plan on at least 6 sessions or so to deal with an issue. However, most people usually feel a significant effect in 2 or 3 sessions.
Okay, well, Seth, fair up. So.
I'm up.
How long?
I'm absolutely happy to answer that question. A typical visit or first visit in the office lasts about 45 minutes, and then the treatment after that can last per session, that is, anywhere from as little as 5 or 10 minutes to as long as 15, 20, 25 minutes, depending on the condition the person is coming in for, the overall health, as you had mentioned, and if they, how they're taking care of themselves outside of chiropractic care. And in terms of how long should someone expect to stay in the office, and that usually depends on the particular condition. However, I usually see results within 6 to 12 visits. Much like exercise, chiropractic care is a process that happens over time.
Hey, Zan, are there any times or certain issues that you would not recommend someone come in for a massage?
Yes, I would. If you have a fever, it's not a good idea to get a massage. If you are coughing and sneezing from a cold or having the flu, it's not a good idea to get a massage. If you've had a recent car accident, I have had people call up and say, I was just rear-ended, I'd like you to help and work on my neck, and it's suggested that, they get checked out first before coming to get a massage. Mm-hmm. So the big one is fever. You don't want to come if you have a fever.
Excellent.
Okay, so Louise,
yes.
Now you're a practitioner. What did you have to do to get there? How do you get licensed?
Well, that's a good question. It's kind of a long road, I think. First, you have to have a 4-year bachelor's degree from an accredited institution, and then you need to go to acupuncture school. I went to the New England School of Acupuncture, which is a 3-year full-time program. Yeah, and you also have to go through a certain number of hours of clinical training, and once you go through all of that and graduate, you then have to be licensed by the national board. You have to take exams to get licensing, and then after that, you have to be licensed by the Board of Registration in Medicine in Massachusetts, which is the same board that licenses physicians in Massachusetts. And then you have to continue to keep your license active by doing continuing education.
Seth, how do patients find a chiropractor? Are they referred by a primary doctor, or is there other ways that you can find a chiropractor?
The most traditional way is searching on the internet, perhaps to find a website, or going through their insurance's website, or even more commonly, word of mouth. 98% of the insurance companies, if someone is going to be using insurance, you do not need a referral from your primary care physician. So it's very easy to literally walk in and set up an appointment, or call in to set up an appointment.
So, Zan, what do I do? I'm a patient of yours. What do I do during a session?
What do you do?
Yes,
okay,
what am I
yes,
doing?
I do tell you what to do when you're on the table.
All right.
Well, what you do is you are asked to just concentrate on your breathing, typically. Concentrate on your breathing. Don't speed it up. Don't slow it down. Let your body sink into the table. Listen to the music. Focus on the music, your breathing, and how my touch feels to you. And so if you ever want more or less pressure, I just have you say one word, less or more, so you don't have to think too much. I don't want you thinking too much on the table.
There you go.
So we have, Louise, when someone is to seek herbal medicine treatment, are there specific illnesses a person would have to seek to?
Well, that's a good question. Chinese herbal medicine is also another modality of Chinese medicine. And some people like to take Chinese herbs and other people don't. Actually, in China, Chinese herbal medicine is much more popular than acupuncture. Most people do herbs. And Chinese herbs are very helpful for lots of different cases. For example, it's good for pain such as migraine and arthritis. It helps for people who have chronic illnesses such as diabetes, or women who are going through perimenopause and menopausal issues. It's very, very helpful for that. So it's really kind of up to the patient, if he or she wants to try Chinese herbs. But herbs can help with virtually anything that acupuncture can also help with. And a lot of people do it in conjunction, one with the other.
Well, it's all really interesting, and I'm learning a lot about this. But believe it or not, this is we got to wrap it up. It goes by fast. But that's so it's I'm sure we can continue this discussion. I've learned a ton, and I hope it was helpful to the audience out there, and the information is available. If you'd like to get more information about the type of services that the guests provide, you'll be able to tune into the credits. We give some information about how to get a hold of them from there. Feel free to contact them. My guest today, Zan Redfern of Redfern Massage Therapy.
Thank you.
She's located, you're welcome, located in Stowe, Mass. You can check out her website at www.redfernmassage.com or by phone 978-461-2169.
Yes, thank you.
Dr. Seth Barron, Barron Chiropractic and Wellness Center, located in Acton, and he can be reached via his website, BarronChiro, CHIRO.com. And Louise Dunn, she is a licensed acupuncturist and Chinese herbalist with Reservoir Family Wellness, located in Acton, and she can be reached at www.reservoirfamilywellness.com. And again, my co-host, Carrie Runeck, president of It's Your Call. Her website is itsyourcall.com or 978-772-9600. I'm your host, TJ Dyer, your local financial planner. Thank you for watching the program, and until next time, stay connected.